All right, I'm starting it.
Good afternoon, everybody. I was just adding in the chat box that you want to post your questions in the chat box throughout the presentation. Thanks so much for joining us and your patience as we prepare to have this great conversation today. Welcome to the University of Vermont's Post-Bacc Premedical Program info session. And we'll go through a quick agenda. We'll do introductions, and then we're going to really dive into what is UVM's Post-Bacc Premedical Program. We have one of our students with us as well, so you're going to get firsthand experience as to what it is like to be a student in our Post-Bacc program. We're going to talk about a lot of other components of the program, including our Post-Bacc hub, our community hub, the networking and the community that is built here as Post-Bacc students, and also the opportunities to build a strong candidacy for your health school, medical school, whichever is the next in your pursuit for a career in medicine. And Beth Taylor Nolan, who is our Associate Dean and Program Director, will walk us through all the logistics that we have for UVM's Post-Bacc Premedical Program. As I mentioned, please put your questions in the chat box throughout the presentation. This is being recorded. We will share the recording out with everyone who has RSVP'd. We're so happy that you're here. My name is Nicola Willier-Fenton. I work in our continuing and distance education along with Beth Taylor Nolan, who is our Associate Dean in UVM's Continuing and Distance Education Department and the Director of our Post-Bacc program. Beth, we're always so happy to have you with us. And Matt just jumped in at the last minute. We're so psyched that Matt is here to join us to give his perspective as what it's like to be a UVM Post-Bacc pre-medical student. And Matt just graduated pretty recently with a Bachelor of Science in Environmental Science from UVM. And we're going to hear a lot more about his work experience that he's getting right now and his volunteer experience as well to help build his candidacy. Matt, thanks so much for being with us. Okay, I'm going to toss this over to Beth. Give us an overview. What makes UVM's Post-Bacc Premedical Program one of the premier programs in the country and one of the most unique and sought-after programs as well?
Well, thanks for joining us today, and I look forward to sharing some information, but also answering some questions. Matt and I will be able to, I think, help you learn more about the program. So the Post-Bacc Premed program is, I think, unique in the fact that we are located, the university and the university health network, the trauma level 1 trauma center, is right on our campus. So our students have the advantage of taking courses, the science courses on the UVM campus, and then participating in research and patient care activities within the hospital. It's walking distance. So I think that is a very unique feature of our program. So the Lerner College of Medicine is a wonderful partner to us. We have an articulation agreement with the Lerner College of Medicine, and our students take a lot of coursework in the College of Medicine and engage with faculty, research, and other opportunities. So I think those are some pretty unique geographic features. Some other things about our program that I think are really helpful to students. We have MCAT preparation. We help students prepare not only their AMCAS application materials, but we do interview prep with students. I'm always available to talk to students about what their personal statement should include and what their list of medical schools should consist of. We have a committee letter process, which it features letters of recommendation from faculty and from patient care and research faculty. That is a composite letter that students have available to them, and it's for osteopathic medical school, allopathic medical school, and dental school. And then I think the other thing that's probably the most interesting part of our program is it's custom designed. So it's designed based on what you need, what track you're interested, what pre-health track. So a lot of students are interested in medical school, but lots of students are interested in physician assistant, nurse practitioner, occupational therapy, physical therapy. So we are in a position to customize your academic plan.
Great.
So
thank you.
We have lots of things.
Thank you, Beth, for giving us a quick overview of the program. And please, as I mentioned, if you have questions for Beth and for Matt throughout the presentation, please put them in the chat box. I'll keep an eye on those. We're going to go over the tracks in just a few minutes with Beth because we have 2 new tracks as well that we're going to talk about and dive a little deeper into the advanced track and also our pre-OTD track as well. And there's a new OTD program coming to the University of Vermont next fall in 2022 that we'll talk about in a moment. But Matt, I want to go to you. So let's make sure you unmute your microphone so we can hear you. What drew you to this program? I know you came to UVM, so there's a natural draw. I know you're from New Hampshire, but there's a natural draw to the area. But why this program for you as you're thinking about a career in medicine?
Yeah, that's a good question. So obviously, I had some prior experience as an undergrad at UVM, so I knew kind of the area, which I really actually fell in love with throughout undergrad. Having Burlington and then also having so many different things to do in the surrounding area, just a short jaunt away. But I was also just really drawn to the fact that I was able to meet face-to-face with an academic advisor in pre-COVID times. And we sort of went over my transcript, and they were very helpful in helping me put together kind of like a preliminary program plan, and just sort of helping me figure out where I was at in this journey and what I needed to do in order to get where I wanted to go. So for me, the kind of customized, personal program design was really a huge draw for me, on top of just already loving Burlington and Vermont.
And tell us about what track you're on and what are your hopes? What are you trying to achieve?
Yeah, so I'm going to be applying to medical school, probably primarily MD schools, and I'm currently studying for the MCAT. I'm actually was taking a practice MCAT earlier today, so the timing is just right. But I'm actually hoping to apply next cycle and ideally matriculate in the fall of 2023.
To be able to watch your progress. Thank you, Matt. We're going to come back to you in a few minutes as well. We want to hear more from you. And if you have any questions specifically for Matt, as he is knee-deep in the program right now and his preparation for the MCAT as well. But Beth, let's talk about, you mentioned many of these tracks already a few minutes ago, but I want to unveil and talk about the two new areas that we have for our students as well and prospective students. Tell me about the advanced track, and on the next slide we can talk about the pre-OTD.
Sure. So a couple of years ago, we started talking with the College of Medicine about developing an advanced track for the program. We were hearing from students that they wanted to go beyond just the required courses for medical school or any of the other health professions. And so we wanted to think about advanced level courses that would be applicable, that would show proficiency at a higher level. And so we've got 3 courses that are ready to go this fall. I think they're very applicable and helpful, especially as you're thinking about the MCAT and you're thinking about being in the best position you can be when you submit your application. It takes a full year to apply to medical school, so this is a good thing to be doing. You're showing that you're still engaged in coursework and you're able to get more advanced level sciences. The pre-OTD is also new. The coursework is not new, but where you would land in a graduate degree program in occupational therapy is new to the University of Vermont. The prerequisite science courses are very common across all of the tracks, but if there's something specific to a health professional graduate program, we could factor that into your academic plan. So the occupational therapy doctorate program is going to be entry level. It's very exciting to have that as an opportunity at the University of Vermont, and our post-bac program would fulfill all of the requirements for graduate school.
Great. And I know the majority of our students come in through MD track, similar to what Matt is describing, but it's really fantastic to see all of these different opportunities for students. And on our website as well at learn.uvm.edu, if you click on the blog, you'll see a variety of stories with our post-bac students in different tracks. So you can really see some examples of students that have navigated the other tracks as well. Matt, I want to come back to you because one of the pieces that is also unique to the post-bac program is the community. It is an incredibly supportive community, ends up being very tight-knit. I see posts about, who needs my prep books and who needs this, and I need a roommate, and there's a new job opportunity over here. And so tell us what the community has been like. And you are in a special role, if you will, as part of the post-bac community. So explain that for us.
Yeah, so the community hub it seemed like in its infancy was kind of like a response to, COVID and everything being online. Giving students a way to still connect with one another who were in this program, so that pre-med students could find other pre-med students and PA students could find one another, and all the different tracks could sort of, find their sort of peer group. But it also, like you mentioned, was a super helpful place to find things like housing. I saw a lot of, people who were looking for housing or looking to fill a room in their house. So it kind of served that role. I actually acquired a set of Kaplan MCAT prep books through the hub, and that's been pretty instrumental in my prep so far. So I've benefited pretty greatly from it. But yeah, so my role as an ambassador, we have the peer ambassadors within the program who kind of are centralized on the community hub. And that's, a place where post-bac students can reach out to their ambassadors and, schedule a phone call if they're confused about something or they just need a little bit of clarification just about this whole process, because it is a very kind of long and emotionally strenuous process. And having that access to your peers who are, maybe a step or two ahead of you in it, can be really helpful for students, and I know it was super helpful for me.
And that network continues to grow, and as people come out of the program and go on to various different health schools, keeping that connection is really important. Before we head to this video, Beth, I thought maybe you might want to touch on the question from Travis. Do you have any stats on how many of the MD, DO track students get accepted into medical school on average?
So on average, it's over 90%. In the first year of application, and we do keep track of students' progress. We rely on the students oftentimes to tell us where they have gotten an interview or an offer. So we're very proud of our placement rate, and we look forward to helping students. That said, sometimes students don't get in the first year or the first try, and that's why we developed the advanced track, because that can be very helpful to students to stay enrolled.
Questions too about the format of classes for this fall. Beth, would you share with us what the options are for students?
So it's back in person, largely in person for the sciences. UVM did deliver all of its coursework last year remotely as well as in person, but this fall it is in person.
Describing the cohort that post-bacs are in classes and courses with other undergrads. Just explain what that.
Yeah, so they're all merged classes. So for example, your Chemistry 31 class would be a mixture of Post-Baccalaureate Premedical Program students and undergraduates. We often hear from faculty that they know exactly who the post-bac group is, because you all sit together in the front row and pay attention and ask good questions. So it is a merged environment, and oftentimes the post-bac students sort of congregate in different ways and in different labs.
And so oftentimes, depending, because post-bacs can start summer, fall, and spring,
yes.
It seems that they navigate towards each other, whether it's the start dates that they're starting or maybe different classes that post-bacs are in. And now that we have the community hub, it's even easier to make sure that you find your other post-bacs as well.
Exactly.
We're going to get back to those questions in a few minutes. I see Stephanie and Satasha also adding some questions, so please keep typing. We're just going to turn off our cameras here for just a moment. I want to play this video. This is from one of our post-bac pre-medical students. He just finished up within the last year and is in the process of applying to medical school. And why I wanted to share Mike's story is that he changed his career. And maybe that is true for many of you, that medicine has always been in the back of your mind. It's been something you wanted to pursue. And that was very true for Michael and very true for many of our post-bac students. So I wanted you to be able to have a moment to hear a story of one of our students that made a pretty life-changing decision and how that's gone for him. So stay with us. I'm just going to turn off my camera so that you can see this video full screen. Be right back.
So I went to high school in Vermont, ski academy. I grew up ski racing at Pico, and I went to college, I ski racing at Boston College. I originally started the pre-med track, so then after college I took a job in finance in Boston, and I just didn't feel right. I enjoyed it, but it's always in the back of my head. I always kind of wanted to do medicine, and really it's like athletics and sports medicine. I'm pursuing what I want to be doing, but another thing is, since I've gotten older, another thing I've realized is location's a big thing for me. We're at a crossroads. I was like, you know what, I'm going to try post-bac, because it's something I always wanted to do. It's kind of leading me here. I've thought about it a bunch. I've done bigger cities. I'm more I like my activities. I like being really close to the mountains. For me, it was like, if I have the chance to link to UVM, which is in Vermont, which is where I really want to be, I might as well do that. It's a big, scary thing. And I was like, okay, I'm just going to take chem over the summer. We'll see, no pressure, and see how it goes. I got into the groove, and then I just kind of did it, and I finished orgo, biochem, and then physics last summer. And so now I'm studying for the MCAT. The mountains are here. It's an awesome place to be. You're going to be studying a lot. When you're not studying, I can go sneak a run up Mad River and come back, or there's some mountain biking trails close by. But I definitely think being on campus is a special part of the program. You get to study in the library right there. It's motivating. The hospital's right there. That was definitely very motivating and inspiring. If it's one of those things that you really want to do, go and do it. Don't be afraid.
Hopefully that gives you a little bit of an indication as to how Michael made that switch and made that decision to pursue a career in medicine. And if you're making a career pivot, we'd love to hear what you're considering and what you're moving from in the chat box if you want to share that. And I know there was a few other questions coming, so we'll keep an eye on those. But let's continue. And Matt, I want to hear from you in just a minute about the experience that you've been gaining. But Beth, one of the key pieces of our program is the variety of opportunities that our students have to gain experience. What is that, and why is that so important?
So in addition to the basic science courses that are required, we think it's very important for students to have access to workshops, to speaker series, and the College of Medicine and the Health Network have been very gracious in including our students in these seminars, the Grand Rounds program. And through those key sort of connecting points, I think students make some pretty good inroads. It's a networking opportunity as well. So I often hear from students that they learn about new opportunities for research and patient care, oftentimes through participating in these kinds of events. So we make those opportunities available to students, and we publish it in the hub, and we make sure that everyone is.
And on the screen here, I just switched over to this slide too, are some of the other hands-on experiences that our students get. Can you just walk folks through what these are?
Sure. And, one of the things that's been most challenging, as everyone knows, is that in the past year and a half through the COVID pandemic, lots of these opportunities didn't exist for students. So we're very excited to have these things back available on campus and in person. the suture clinics, the injection clinics. These are all opportunities for students that are run by the College of Medicine, and our post-baccalaureate students are welcome to participate. So I think there's just a wealth of information on the hub, and you can always talk to your program ambassador like Matt.
Right. And Matt, so I know that you, I think you're working at the McClure Respite House, and also do some volunteer work. Explain what you're doing and how is that helping to build your candidacy, you hope, for medical school?
Yeah. So, I mean, medical schools expect kind of a lot of different things from candidates in addition to a good MCAT score and strong grades. Things like volunteering, clinical experience, whether that's directly interacting with patients, or in a volunteer kind of setting. So as you mentioned, I'm working at the McClure Miller Respite House as a health screener up in Colchester. And that's really awesome just because, I'm very interested in family medicine. So I get a lot of interaction with families coming in and out there, as well as, admitting new patients, things like that. And as far as volunteering goes, I tutor for the U.S. Committee on Refugees and Immigrants, their Colchester office. They do an English tutoring program for ESL students who are refugees from various countries. So I spend my Friday mornings on Zoom with a young fellow from the DRC teaching him English, which is really fun. And I think especially, if your goal is to practice medicine in like a larger city, or even in a place like Vermont where there's a pretty significant immigrant population, having that bit of perspective is super helpful. And it's been super enriching for me. There was another thing on here that I saw on one of these slides about the Vermont Lung Center, and talking about those grand rounds opportunities where you can basically go and kind of absorb some research. I actually was able to get in contact with one of UVM Med Center's pulmonary docs and kind of did a small sort of quality improvement study with him that was kind of COVID related. It was looking at respiratory function testing labs and how they were responding to the pandemic, and was actually able to get a short paper published in a solid journal. So been busy.
Awesome.
But yeah, it's been a lot of fun.
Awesome. Good for
That's
you.
Fantastic. And I think that just demonstrates what Beth was talking about, is these opportunities, because we are geographically, physically connected to the medical school and the hospital. These opportunities seem to be widely available for our post-bac students. So Beth, I want to get into just a couple questions. Thank you, Matt, for sharing that. We'll come back to you in a couple of minutes. But Stephanie's asking the customizability of the program. And I think this is good too, because you're seeing the sample curriculum on here. Beth, she's asking, she has a BFA in illustration, and it's not unusual that we see folks come in with fine arts background, looking to get into science and medical background to apply for the program. So what would you advise for Stephanie?
So the answer is yes, it is. And we help students all the time. One of our chem faculty, who is now retired, Dr. Michael Strauss, is an artist, and he now is teaching. He's changed from being a chem professor to being one of our featured artists in our Osher Lifelong Learning program. So the answer is yes. What we would need to do, and we often do this with students, is we research what are the requirements for the graduate programs that you are specifically interested in. You and your advisor would develop, a list of prerequisites. We would make sure that we have those prerequisites available to you, and we would put an academic plan together and put it in motion. So the answer is yes.
Good answer. And what we're seeing here, Beth, is just sample curriculum. So maybe just share, again, it's customizable, back to the point you were just making.
Yeah. So some post-bac programs have a cohort approach. We do not necessarily do it in that way, because we don't want students to have to retake courses that they've already taken or earned credit for. So it's oftentimes, somebody might have taken one semester of general chemistry or one semester of biology. So we would pick up at that point where a student left off. But the medical school pre-medical requirements, general chemistry, organic chemistry, biology, physics, that's the most basic of the required courses. When you get into some of the physician assistant programs or veterinary medicine, there are additional requirements, and we work with students to develop the plan according to whatever track they're looking for.
And on our website too, there is a lot of detailed information of sample courses that would be in those specific tracks. So if you are thinking of veterinary medicine or dental, you can learn a lot more about what Beth is talking about of those specific tracks. Wanted to answer Inez's question too, given the course offerings. We get this question a lot too. How long would it take? Inez is asking, is it possible to complete all pre-med requirement courses in a 12-month period?
It is, and most students, some students do it in a fast track approach, like a 12-month approach. You would need to incorporate a summer semester into that mix, because the chemistry, general chemistry, serves as a prerequisite for organic chemistry. But in that scenario, you might take general chemistry, biology, and physics in the fall semester, the same sequence in the spring, and then organic and biochemistry over the summer. So it's an intense experience, but it certainly can be done.
Absolutely. Thank you for that question. And Travis asked, do you offer advising in which extracurricular activities that students should be taking in terms of clinical, volunteer, and research? And I think, again, the answer is yes, but maybe expand on that, Beth.
Yeah, the answer is yes. And we oftentimes build upon your areas of interest. So, as Matt was saying, he's incorporating tutoring into his community service plan. I've had students who are really interested in art from the heart programs because they're interested in working with children in the hospital. So the answer is yes, and we have a variety of opportunities, and it's a small community, so there's lots of opportunity, lots of access to really good things.
And another question here as well, and we get this a lot too, if prerequisites were taken longer than 5 years ago, do they need to be retaken?
That's an it depends answer. So there's not really a rule per se, but sometimes students will say, my question usually back to students is, how confident do you feel in your ability to use information that's more than 5 years old, say on the MCAT? Or do you think that you have a good enough base to move to the next level? So we really do some in-depth investigation when coursework is over 5 years, but it's not a hard and fast rule.
Okay, great, and great question. Thank you for asking that. And I want to get to Satoshi's question as well, as we're starting to look at listing here of schools that our students go to. Satoshi asks, my question, it must have disappeared, but how old is realistically too old to try to get into medical school? And I don't know if Beth has the crystal ball to answer that question, but we have seen such a variety of age ranges of our students that come through post-bac. So what are your thoughts on that, Beth?
Yeah. There is no such thing as an age limit requirement. We work with a wide variety of students who of all ages and backgrounds, and we don't see an age limit. So I think it's it's a very personal thing that you would want to be rest assured that age is not a limitation in terms of our program.
And our program leads to so many amazing schools to continue careers in medicine. And I no intention of trying to read all of these, because we're so fortunate that there's a lot of slides with a lot of schools that take our students. But I think one of the most important things that come out of these slides is the success rate that our students have. And I know Beth mentioned about a 90% success rate. And I want to come back to Matt for just a minute. You are getting ready to take the MCAT.
Yep.
How are you feeling in terms of preparation, and how do you think this program has prepared you for that next step?
Yeah, so I'm feeling pretty good about it. I just took a sample full-length MCAT today, and was very happy with that result. So just going to keep doing practice and build up that stamina for test day. As far as how the program has prepared me, I think it's been super helpful, particularly for me. I've always struggled with general chemistry. I'm sure I'm not alone in that sentiment, but having the very recent, I took general chemistry a few years ago during undergrad, but having the recent input of, like the physics, 2 semesters of physics under my belt during the Post-Bacc program, I think helped general chemistry when I was reviewing it, helped it make a lot more sense, because everything comes down to physics. But yeah, I think it's been super helpful also just in keeping that momentum and that motivation for, just learning and getting things done. It's been super helpful in that respect.
Looking forward to seeing your success as well. So Beth, we've touched on a couple of these questions already, that classes will be back on campus in the fall, and approximate time that it can take anywhere between a year and a half, maybe a little longer for some folks that do part-time as well, and some people work during the program also. Admission dates that you're seeing there, I just wanted to keep up the summer date just so that people have a sense as to, if you are looking at the summer schedule starting next summer, just trying to sequence when this might be right for you. The deadline is again earlier, so you just want to kind of think about a couple months in advance before you would start. So Beth, always the question too is, how much will it cost? And so I just wanted to make sure that we touch on that in terms of the cost for students.
So UVM as a public institution has in and out of state tuition rates. So our students pay by the credit hour based on your residency status. So I would encourage students to look at the UVM Student Financial Services webpage that would give all of the detailed information about tuition and fees.
Great. Thank you so much. And then as you are also looking up that information in terms of what it might cost you if you're in state or out of state, what are some of the other pieces, and we have them listed here, that students would need to apply?
Yes. So the application process is pretty straightforward. You can do it if you're only applying to our program. Feel free to just go ahead and apply. You can also apply through the centralized application service, which I know many of you are probably very familiar with. We are part of Post-Bacc, which is the centralized application service. So you can either do it direct to us or through Post-Bacc. So we'd like to hear from you. Tell us a little bit about yourself. Write a page about why you want to pursue a health profession. We do need 2 letters of recommendation. They do not have to be from faculty. They can be from your employer, your clinical care manager, your research faculty, so a friend or colleague. So we're not strict about who the letters of recommendation need to come from. We don't require official transcripts. Unofficial are just fine. And if you're having any financial difficulty regarding the application fee, please raise your hand, and we can make arrangements regarding that.
Great. Thank you so much for that. And Beth, we do have another question as well. Dilma says, I just graduated with a dual degree in biology and pre-med and psychology, took the MCAT and got a 515 score. Was wondering if this is the pathway to medical school because UVM is on my list. So it sounds like that Dilma is closer to applying to UVM Larner College of Medicine.
Yes. I think that's a really important question that you're asking. So there's two things that I would recommend to a student in your situation. One is taking a look at the advanced track. If you're just looking to take additional coursework at a higher level, maybe you're interested in doing a patient care or research opportunity, so that advanced track might be a good option for you. The other thing that a student in your situation might want to look at an accelerated Master of Medical Science degree. So UVM has a one-year accelerated Master of Medical Science. It does serve as an excellent pathway into Larner or other medical schools. So I would encourage you to take a look at
Great.
that.
Yes, and we've had lots of our post-bac students do that as well, and they're glad you're. And then we also have a question too. This is a great one too. The acceptance rate into our program, into our post-bac program.
So you just have to qualify. So we are a career change program. So we are not a remedial program, meaning that we're designed for folks who have not taken all of the prerequisite courses. That said, if you have and you want to do the advanced track, we can certainly work on customizing a plan. But I don't have an acceptance rate because I like to admit everyone who's qualified. So we look to a guide of 3.2 or higher GPA. That doesn't mean that somebody with special circumstances at a 2.9 wouldn't gain entrance. We probably want to have a different kind of conversation about your coursework. But there's not really a number associated with that.
And Beth reviews all applications, so she knows our students very closely. Hope is asking just timing. If waiting to get final grades out of the spring semester when she'd be graduating, could she start in the summer? And how, it sounds like there's a small window
Sure.
there.
And we wouldn't require final grades. So if you wanted to apply after your fall semester grades were posted, that would be fine. We do like students to submit an updated transcript after they graduate, just so that we can have a full picture on file, but it's not required.
Great, thank you. I don't think we've had that question before, so that's great for me to learn that as well. And Travis asks, do post-bacs qualify for financial aid, specifically federal student loans?
Yeah, so the financial aid picture is you need to fill out the FAFSA form. The coursework that you enroll in needs to be required so that there's an intentional plan in place. And you are limited to one 12-month period. So that's often why students do an accelerated track with us, because the federal guidelines limit your timeline to one 12-month period.
Great. And then, Daryl, lots more questions coming in. Courses during the day, are there evening courses? Is it kind of a mix?
So most of the lectures, and Matt, I'm sure you've experienced this, a lot of the lectures are during the day, and with labs mostly in the evenings as well.
Great. So it sounds like a little bit of a mix too. And Mary asks, do many post-bacs do many post-bac students at UVM tend to enroll in UVM med school following completion? And so, and the linkage, maybe go back to explain what the linkage agreement is with Larner, Beth.
Yeah. So we have a linkage agreement with Larner, which is wonderful because it gets your application out of the computer and into someone's hands. So we compile a list of students who earn a 3.5 or higher GPA in our program. It's post-bac specific. Used to be a combination of post-bac and undergrad, but we all agreed the last year or so to just have it reflect the post-bac GPA, and a 509 or higher MCAT score. And then you get an interview, which is a very big deal. And yes, we do have a lot of students who end up staying, in-state and out-of-state students end up staying at Larner because they love it.
Yeah, and they love the area, as Matt was saying as well. And Doma says, does UVM have a graduate program in neuroscience? He had minors in neuroscience and microbiology.
Yes, so there are graduate programs, and I would encourage you to look at the website at all of the various graduate programs. So there's an anatomy and neurobiology program. There are PhD programs in cell biology. So please take a look. There's a lot of information there.
Great. And another question too, two more questions Travis asked. Are there any other linkage agreements?
Not currently. Oh, one very important one. It's with our College of Nursing and Health Sciences. So if you are interested in the nurse practitioner program, occupational therapy, physical therapy, we do have linkage agreements with those graduate programs. Our linkage agreements right now are internal to the University of Vermont, and with the other ones not in place anymore.
Great. And Daryl is wondering if there's any weekend courses. Yeah, I didn't think so.
No weekend courses.
Yeah. It looks like we maybe have one more question coming, and I know, right? And Matt can attest to that. So just wanted to keep an eye on, fall is coming, spring is coming. I know it might not seem like it might be a far distance off, but oftentimes, as Beth listed, of the requirements to apply, you might need some time to be able to gather those things. So just keeping an eye on the dates to apply as well. So I want to just, and I will get to Inez's question here in just a moment, but I just wanted to come back to Matt again for just a moment. For many of the people with us today, they're clearly thinking about this, that this is maybe something that they might want to do. What advice would you have for prospective students considering UVM's program?
Yeah, so one thing that I definitely wish that I knew, or wish somebody told me going into this, was just to emphasize taking care of yourself, because this is a track that it's long, it's a lot of work, and rates of burnout are high. So make sure you take care of yourself, have something that you can do to recharge and get away from chemistry for a bit. And then another thing would just to be to dive right in and try and immerse yourself as much as possible. Like those AHEC clinics, I was able to attend a few of those. They were great. I met a lot of other post-bac students through that. In a setting where with online classes it was kind of difficult to do that. But yeah, really just kind of diving in head first. And then another thing would be making a plan. You may not have the whole picture, but just kind of general milestones of where you want to be at what point in time can be super helpful in just guiding your decision making and helping you succeed.
To see what's next for you, Matt. Thank you so much for sharing your perspective. Inez asks, Beth, what is the Vermont residency qualification for in-state?
Yeah. So residency, I'm not the university residency officer. There is one. And so I would encourage anyone with residency questions to, again, do your homework, because it does matter. There are rules regarding the length of time you need to live and work in the state of Vermont prior to enrolling. And I often hear stories from students who say, I didn't understand that, and I thought that I could flip my status from out of state to in-state once I had been here for a year, and that is not the case. So it's really important that students read the fine print about residency, and then if there's any questions, to contact the university residency officer about your specific circumstance.
Great. Oh, good. That seems to be very helpful for Inez. Thank you for asking that question. And our last question is just, again, timing. Oh, Daryl's giving us one more too, but if you want to apply for fall of 2020, when should that prospective student apply? Soon. So we review applications. We don't let them sit and wait. So if you want to submit your application for next fall, I would do it in a window of time, say anytime between November and March. But we do accept applications on a rolling basis. So and review them within 2 or 3 weeks of them being complete. Yeah. So that way too, if it's something you're thinking about, then you've gotten your acceptance and you're in, and you've got a plan in place as well.
Yeah.
Great. Thank you so much. Looks like our questions have slowed down and we're getting some gratitude for the information. So thank you, Beth, and thank you, Matthew, so much for being here and sharing this incredibly valuable information to our prospective students. We hope to see all of you in UVM's Post-Bacc Premedical Program, and we wish everybody a wonderful afternoon. Take care.
Thank you.
Thank you.